Victoria has woken up to its first day of a snap lockdown as the number of new locally acquired COVID cases increases by 1. The state will undergo a stage 4 restriction for the next 5 days in an attempt to contain the spread of what the Premier is calling a hyper-contagious variant of the virus.
The city deserted on day 1 of the so-called circuit breaker. Melbourne restaurateurs again bearing the brunt of the snap lockdown on what should have been their busiest weekend of the year.
It's absolutely heartbreaking. I've got 148 phone calls just for Valentine's Day to let people know that we unfortunately are trying to move romance this year till next week.
Still reeling from the financial losses of 2020, Lover is set to take another hit after ordering thousands of dollars of fresh produce for a fully booked weekend that's now been cancelled.
Over the next week, loss of income is $40,000.
Daniel Andrews promising additional support as he defended the need for a third lockdown.
As desperately keen as we all are for it to be over, I can't deny the evidence. I can't go shopping for the advice that I like.
Over 20,000 tests taken yesterday with one new positive uncovered, the friend of a worker at the Holiday Inn. That cluster climbing to 14 with nearly 1,000 close contacts. Health authorities denying claims a guest was given permission to use a nebuliser thought to have spread the virus.
The information that we had from our health providers, there is no evidence for that.
International flights to Melbourne now suspended until Thursday to allow the state to get the outbreak under control.
I declared Greater Melbourne a hotspot from the Commonwealth point of view last night.
The number of exposure sites growing, with popular shopping centres, function venues, public transport sites and Terminal 4 at Melbourne Airport among those listed. 2,300 travellers who passed through Melbourne Airport have been contacted. The positive case from an airport cafe worker so far not spreading to other staff. There was panic on social media today as it emerged the official directives by the Victorian Chief Health Officer has the lockdown ending in 2 weeks rather than 5 days. But Brett Sutton says that's just how the documents are scripted and doesn't indicate a longer lockdown than expected.
That's always been the way that legal have approached it. And nothing should be read into it.
Victorians must wear masks indoors and outdoors, stay within 5 kilometres of their homes and only venture out to shop for essentials, caregiving, exercise and work or study if it can't be done from home. The restrictions interrupting a nail biter at the Australian Open last night, with crowds unhappy to be sent home during Novak Djokovic's 4th set with Taylor Fritz.
All patrons are required to leave the arena now.
The Open continued today, minus the crowds, as Victoria returns to life under lockdown.
And joining us now with more from Melbourne CBD is our reporter Abby Dinham. Abby, good evening to you. Third time round in terms of lockdowns. How would you say residents are feeling right now?
Good evening, Anton. Well, I think resignation was the overwhelming feeling amongst most of the people we spoke to. There is a fair amount of concern about the UK variant of this virus and just how contagious it is. So people are pretty understanding of the situation, and they said that having a 5-day duration on this lockdown did make it feel a bit more bearable. One woman we spoke to described it as a necessary evil in avoiding a third wave.
It's hard, but what can we do?
We wake up and we have to adapt to a new reality.
5 days is better than 3 months, I guess, like the last time.
And the other thing that there's been a lot of focus on, Abby, is that nebuliser that you mentioned in your package there. What does the Premier, Dan Andrews, have to say about that?
He had very little to say about it, Anton. He wouldn't give any comment about the situation, whether health authorities knew about it. He wouldn't comment on the man or his actions. Instead, he referred all the questions to the Hotel Quarantine Authority. Its chief, Emma Casser, gave her press conference a couple of hours later. She reiterated that health authorities did not know that the man was using a nebuliser, despite him telling newspapers that he had permission to do so at least twice. She says that they wouldn't have even known he had the device unless he declared it to them, as they're not able to check people's bags as they're going in. However, she did say that from now on, health authorities would be taking extra precautions to ensure that people knew that nebulizers were on the restricted list in hotel quarantine.
That is SBS reporter Abby Dinham updating us on the latest from Melbourne.